I'm Sharon Madison, and we live in Wilmore, Kentucky. I was introduced to KORT back in 2020. I've had kind of a tough last 2 years. In 2020, I was diagnosed with cancer. It was breast cancer. It was actually a recurrence of breast cancer 30 years later. So we decided to go ahead and do a bilateral mastectomy. I didn't need to do chemo, which I had done 30 years ago, but I did do radiation. So I did 41 rounds of really tough radiation. While I was doing the radiation, they started to talk to me about, my surgeon especially, that I really needed to do physical therapy. On my left side, the surgeon wasn't able to get all the cells out without me losing full control of my left arm. That's why the radiation was so tough. But he said I needed to have someone to help me with it. And Katie, her name was given to me with KORT because she has been qualified to work with breast cancer patients. And so I came in here, never had known Katie, and she started working with me. It was like it was just me. She knew my history. She kept in touch with my doctors. And so we worked twice a week, and she had me doing different kinds of stretches to help me with mobility, also to strengthen my legs, and just anything that she knew what I needed to do. She gave me a book to follow, and the book gave me different exercises for breast cancer patients. And so I followed through with the book, and then I would do them here. And then I think it was at the end of November, she said, let's hold off for a bit until February, and then why don't you come back in and we'll just check and make sure you're doing as well as you have been doing. And I said, well, fine. So went through Christmas and everything, and then in January, I was diagnosed with COVID. And it was so rough that I had double pneumonia, which put me in the hospital for almost 2 weeks. I was on forced air oxygen and just kind of almost tied to the bed. They had a physical therapist come in, but I was so restricted, I couldn't move around much. And she suggested in-home care. And I started thinking about Katie. So I texted Katie and I asked her if she would be able to work with me. So she got back in touch and back and forth with everybody here at KORT, and we decided what we would do is we would do it virtually. So I was able to get downstairs and hook up by my phone, and she would work with me. She constantly would check my oxygen level to make sure that the breathing was the toughest part. To make sure I was breathing okay. She checked my blood pressure constantly, and in the beginning we did just little exercises, just small things, because she just did not want me to overdo myself. I think the hardest thing with COVID was, first of all, it was my breathing, because my lungs were still full of, the doctor said, gunk.
So I have been treating Sharon Madison for over a year now. Her journey with me actually started, I don't remember the exact date, but again, over a year ago, after she'd been diagnosed with breast cancer, actually for the second time, had a mastectomy on the left side, and then just ended up needing a lot of radiation. And so she has just really been through the whole gamut of treatments as far as cancer care. So we communicated a little bit during her hospital stay, and once she was finally discharged home, we kind of resumed our care, just working kind of along the guidelines of the R2 program that we have designed for folks who are recovering from COVID. She has done, remarkably well, all things considered. We did initially do some tele-rehab visits, which really was a great option for her as she was recovering. It just was so exhausting for her just to go through the process of getting ready in the mornings and getting out of the house. She still wasn't ready to start driving yet. So we did tele-rehab for a good 2.5 to 3 weeks almost, which was really the perfect segue because it allowed her to regain her strength while we were, staying in constant communication, and we were able to monitor her vitals throughout from home. So it really created the perfect opportunity for her to get her strength back until she was ready to come back in the clinic.
And it was just like a breath of fresh air coming in here. I felt like I accomplished something. I felt like I drove myself. I could walk into the door. I had to sit down quite a bit, and I had to be careful, especially pay attention to my breathing. And we kept my little oxygen reminder, and we would check that constantly. So what I found also, besides me getting better, was that I would look around, and there were other people here that were, people had surgeries, people got hurt really bad, and people were in pain, but nobody ever complained. Everybody who came here, they had such a rapport with the physical therapist, and the physical therapist with each other, and all the clients who were here. So it's been a good experience. I can't say it's been a fun experience, but it's been an experience that I've learned to push myself, and then at the same time to be careful how much I push myself. So I really recommend coming to KORT, doing physical therapy for breast cancer, and especially